What we discovered and did collaboratively these past 2 months were in a sense so life-affirming for those in the shelters that some of us got a chance to speak to, that we simply cannot lose it. We have to find ways to build on what we've learned and to secure a new future around homelessness in the city of Tshwane. If we can move 1,800 people off the streets in 20 days, it means we can reduce the number of chronic homeless people by 40 to 50%. We can end street homeless people for older people and those living with chronic mental illness. We can support those using substances in enormous ways as they seek to reconstruct their own lives. So we want to focus on hearing about that this afternoon. Let me just take you back one moment and give it context. Why do we call it a research colloquium? Since 2015, we're a group of researchers from the Universities of Pretoria and UNISA, working with practitioners, with city officials, homeless and former homeless people to do research on homelessness in our city. We worked hard to help draft policy and strategy, which the city adopted in 2019. We come from very different disciplines. I'm a theologian. There are people from family medicine, anthropology, social work, town planning, sociology, jurisprudence, and today also occupational therapy. We are deliberately working in this transdisciplinary way with different disciplines, practitioners, and communities to find solutions for real-life problems through our research, to help design strategies to overcome homelessness in ways that are evidence-based, not just trial and error, but informed by facts, figures, and narratives that demonstrate sustainable pathways out of homelessness. And that is what this research project is called, Pathways Out of Homelessness. I will just spend one more minute and then I will give back to you, Mike. We acknowledge that there are many pathways into homelessness. People's narratives differ. Not one person has the same story that caused them to be homeless, ranging from unemployment to abuse at home, to discharge from correctional centers, to chronic mental illness, to substance use. And we acknowledge that just as there are many pathways into homelessness, there's not one size fits all in terms of our approaches out of homelessness. And so our research wants to help inform the diverse possible pathways out, which includes a public health emphasis, which includes access to decent shelter, transitional and supportive housing, long-term social housing in every part of the city where there's a concentration of economic opportunity. It includes psychosocial programs, and increasingly it has to include vocational training, internships, access to economic opportunity for people often sidelined. So the afternoon's idea is twofold. It came out of a conversation some of us had last week where Yanni Hiku from Family Medicine and some NGO leaders and others were just talking and saying we want to hear what has happened in the past 2 months, to register it, and then we want to start to document it through video clips, and that already started, through a proper research and project report that can be shared with the city, with our universities, with NGO boards, with possible investors. So that's the first part, to document what has happened. But even more, the second idea of today is to ask, so what enabled this collaboration? How did it happen? There's a new way of working. How can we capture and not lose it? How can we foster this movement where researchers with activists, officials, practitioners, homeless people come together to create a new narrative for the city of Tshwane? So that's the idea, to document and register, but also to ask, what now and how do we go beyond? Welcome. Enjoy this space. Thank you for joining in. I hope it means you want to be part of this unfolding movement. Thank you, Mike.
Great. Thank you so much, Stefan. So we're going to jump right in then to the first set of panelists. So there's quite a number, and in the interest of time, I'm not going to introduce you, but I perhaps will just cue you just so that to alert you that you're up next. So if we could try and go in quick succession, please, as I said, do stick to your time, and if you don't, I will then cue you and at some point ask you to stop and then ask the next person to take over. So first up is Tinuka Malaleke from the city, as well as Wayne. And Wayne suggested that Tinyuka go first. If you're ready to do that, please.
Hello, my name is Tinyuka from the city of Tshwane. I would want to just give a bit of to just unpack what actually happened during this lockdown as far as issues of homelessness is concerned. We're currently having around 23 facilities that are both managed by the city as well as NGOs. But I would want to, just for the sake of this colloquium, just speak more about facilities that the city has been managing. I think what makes our facilities different, mainly from that of NGOs, is that we have bigger facilities. Some in the region of around 350, to at some point having around 400 or things like that. So as a government, we're the ones that had more bigger sites, and the bigger sites made things even a bit difficult in terms of implementation of different programs. Either the programs that we're having include social welfare services, health services, some substance abuse programs, and even some of the entertainment or recreational activities that keep the residents busy. So those are some of the things that we got to pick up. And one of the challenges, obviously, with bigger sites is that even in terms of security, it becomes a challenge, because at some point people go out and you are unable to see whether they're still in and out, which compromise the whole idea about people being kept in one place. So as I indicated, we continue to render social welfare services. We provide with food, and we also try to coordinate other services that include the health, that ensure that we are able to provide whatever relevant services that is relevant to the homeless. Other services which were critical, obviously, include the issues of reunification, where we link homeless people with families, and then they go home and things like that. So those are some of the positive things that we have observed, where we move people who couldn't even who sort of forgotten even how to use bathroom, up until to people who can now have decent conversation with them. So those are some of the proud moments that we are having. So I think in a nutshell, I think from the city side, I want to pause there, because Wayne will be able to share more on sites that are managed.
Thank you, Tinyuka. As said, my name is Wayne Renken, and I'm going to talk about the NGO shelters, but just in the interest, so we made a distinction between the NGOs, church-operated shelters, and the city of Tshwane shelters. And it was not something that happened deliberately, it was something that happened organically since the start of lockdown. The NGO shelters, as Tinyuka said, has fewer people per shelter, but this was done deliberately. As from the collective experiences of NGOs working with shelters and homelessness for many years, we have learned that smaller is better. If it is just about creating shelter for large numbers of people, just housing people off the streets, then bigger is better. But if it's about seeking to find pathways out of homelessness, then smaller is better. In the small shelters, we have seen holistic care is possible for each person. Whereas in the large shelters, as Tinyuka just articulated, it is not as easy as in the small shelters. I would argue that in the long term, in terms of sustainable pathways out of homelessness, it makes more financial sense in the smaller shelters, because the relapse of people are smaller. But this might need further documentation and research. To date, we have opened 17 shelters within the NGOs and churches and so on, with, as of yesterday, 524 people. Only one of the temporary shelters are closing down next week, and all of the residents have proper exit plans. There are discussions with some of the current temporary shelters that are run by the NGOs and churches to develop long-term shelters. But these shelters are a collective effort. It would not have been possible for a single church, an NGO, or an institution to run at this scale. Interesting models of collaboration and partnership have developed during this time in this sector. One, we saw churches opening shelters in their buildings and taking full responsibility, from blankets, food, up to exit plans. They were getting specialized support from NGOs and other institutions in terms of things like social work, health, and other programs. Then we had a second model of churches opening shelters in collaboration with other churches in their neighborhoods. And it seems at this moment, it's an ecumenical process of the churches supporting each other. And they also get support, specialized support from the NGOs and other institutions in terms of social work, health, and other programs. Then thirdly, we saw NGOs opening shelters in their available buildings and spaces, and then getting support from the other NGOs. And lastly, we have NGOs that just provide specialized support at the shelters, specifically around health and social work. What also happened is that we had a centralized food bank that we opened up, or resource center, for these 17 shelters. All donations that the NGOs received went into the center, and not went, it's as if it's past tense, still goes into the central space, and from there it's distributed equally and equitable to all of the shelters. This helped us to see that all shelters have enough and no one is lacking at any shelter, and that nothing goes to waste. We have more than 24 FPOs, NGOs, universities, institutions, and counting that are collaborating to ensure 500 people are holistically cared for. This collaboration, I can tell you, is not going just plain sailing, and it's not always a smooth collaboration as we want it, but it shows that broad-based, large collaboration is possible. It also shows us that in many ways, when the various stakeholders come to play, the complex nature of homelessness, that there is possibilities to find sustainable pathways out of homelessness through the collaboration. I think my time is up.
Thank you very much, Wayne and Tshwane. Are you good to go?
Yeah, hi everyone. Sorry, I didn't see the unmute button. Like it was said, my name is Tshwane. I wear a couple of hats in my life. So today I'm gonna come as just an urban practitioner and as a site manager of a COVID-19 shelter. To give a bit of background of the shelter that I'm gonna talk about, the shelter is situated in Region 4, which is now Centurion, which incorporates Centurion. Oh, can everyone hear me? Is it better now?
If you could just speak a little closer, a little louder.
Is it better now?
Yes, now better.
Okay. The background of this homeless shelter is in Region 4, which incorporates Centurion and Irene in the east and Olive and Old Bosch in the south. The nature reserve is in the west. It's got like 380,000 people, which is the census of 2011. It's got 45 suburbs, 3 memorial sites, and 2 museums to date, but did not have an NPO organization dealing primarily with homelessness till recently, the Centurion Haven of Hope, which was established officially on the 16th of March 2020, running to the formation of the new kid on the block, which is now CHH. A preliminary census was conducted by Lushka Newton, Director of Adaptation and resilience programs of the city of Tshwane and myself, where we were able to find out that in the Centurion CBD only, there's like 7 sites which are equal to 880 homeless people in the CBD of Centurion only, and which really pointed out the need for advocacy and psychosocial services, which exposed the number of the social workers, which are only 3 in this large region. Then COVID-19 hit, where a formation of a consortium of organizations, which is the Centurion Heaven of Hope, Henop's Revival, Durant Blue Family Church, and the Dare to Love movement came together on the eve of lockdown, which is the 22nd of March, to prepare for the unknown. With the City of Tshwane Social Services, Building Maintenance, and the Tshwane Bus Services, the Littleton Community Hall was, say again? Okay. The Littleton Community Hall was converted into a temporary NPO managed COVID-19 homeless shelter. In a few days, it developed into a hub, which primary objective of assisting the street homeless and substance users recovering and still using community in Centurion, Littleton, Irene, and as far as Yevelwood, with a daily distribution of food, clothes, and toiletry relief to the following hotspots, which are like 8. And all in all, those hotspots, we found out there were 602 people that were fed from that, which made 1,806 meals a day. All of the above, through the assistance of the Indian Welfare, the Waterkloof Air Force Base, made everything to be possible, but mostly the Centurion community came out and they opened their kitchens, because at the Littleton Community Hall, we as the newly formed NGOs, we didn't have the acceptability certificate to be able to cook. So they were able to bring in non-perishable items, which people opened their kitchens and they cooked for this whole number of 602 people on daily basis, which was like a breakfast, lunch, and supper. Well, everything went well. The power of relationship and partnership equals to a large team of networking. During this journey, we saw the partnership and collaboration being fuel of our mission. The Doctors Without Borders came in and were able to screen 320 people. This City of Tshwane Environmental Department doing health awareness campaigns. The Sidiba Hope came in with HIV and AIDS awareness campaigns. Well, not everything went as smoothly like as Wayne has said. Challenges. We saw a lot of trials and error during this COVID-19 lockdown, but the recent is experiencing donor fatigue as everyone are feeling the pinch of this. In conclusion, COVID-19 in Region 4 has brought down misconceptions, ignorance, assumptions. It has definitely exposed hypocrisy, but the fear of the unknown looms. As we all know, change is hard. My point is that the hidden has been exposed and must be dealt with. Private made public. And lastly, the 1st of June has been announced as the turning point where Centurion will be given either the old fire station or the old Home Affairs, even both is fine, to turn into temporary transit or drop-in centers. I thank you.
Excellent. Thank you so much, Tshwane. Thanks for keeping within the time there, nearly. Professor Yadihuga, over to you, please.
Thank you very much. I would like to share the screen. So maybe let me just do that, and then I will continue. let me talk and see if it gets going. Let me first say that in terms of homelessness and in terms of health in the inner city, there will be no turning back after the COVID-19. Can I just hear, do you see my screen?
No, I'm not seeing it.
Okay, I'm going to keep talking because the time will just... What else could go wrong? I don't know. Okay, guys, let's just talk. Leave the PowerPoints. What I'm asking is for us to notice that forever we will now say there are many homeless people with lots of needs and we can do something. The way that we cooperated is remarkable. In terms of the healthcare, sorry. In terms of healthcare, we had very strong support from Doctors Without Borders, Sediba Hope, the Department of Health through the Family Medicine Department, as well as the city through COSAP, the city clinics, and the hospital. So this was a joint effort. We were prepared to respond to the needs because of our work with communities and the homeless, work with street medicine since 2014, and specifically because of our project with the city of Tshwane, the community-oriented substance use project, also our postgraduate program with the registrars in family medicine, who has all had experience in community work. So when this happened, everybody could draw together and we could deal with what was needed. It was a long haul that started very rocky for us to get people assessed and assisted. There was very clear crisis around many people who were withdrawing from heroin addiction in large numbers, and that precipitated us to having to deal with the situation swiftly, and we could, within days, we had that under control. And since then, we have been working a large team. If you look at the numbers, we have, do you see it now? I think it would probably be on.
Now, thank you.
Okay, we had 27 delivery points. We had seen 2,272 people, did 14,000, 15,000 screenings, 4,700 consultations. We saw people in withdrawal, 1,052. We haven't documented all of them, and daily we gave methadone to 550, and that was done through family physicians, clinical associates, social workers, peers, support staff, data capturers, 97 people working on that. And we saw services, acute care of a lot of things, and the chronic care in terms of diabetes, TB, HIV. For example, we've now got 100 people on HIV treatment that were either defaulting or never been dealt with before, and many other illnesses. The expenditure on the methadone was close to R1 million in the shelters. So definitely a lot of work was done. Definitely we showed that it's true that the literature says that the most ill people are those in the streets. We have all learned a lot through that. And we're now at the point of saying we need to integrate this care into the rest of the health service. We need to have specific plans for homeless people, and we need to make sure that that works. And this is why this partnership is very important. This is also why it's important for us to do research about this. We have got a group of postgraduate students that will do a series of research projects related to this. And we will work with all of you, including the formal health services and the NGOs, to make sure that we create a health network integrated with a comprehensive care network, including the need for all the other services and accommodation, and that health would play its part to make sure that the face of homelessness and the face of suffering in the streets will change in the future. Thank you.
Thank you very much, sir. Thanks for cutting back on your time. Just a note to all the speakers, perhaps just take a note from Yanni there to make sure that your phone is on silent. Because as he said, what can go wrong will. Just as you are speaking, your phone will ring. So please make sure that that is put on silent. Next up is Maki Telapedi from the, am I right? Is it one of the NGOs in the city, Kitso Lesedi?
That's right. Can you hear me?
Yes, loud and clear. Thank you.
Thank you. Good afternoon, everybody. My name is Makitse Lapeji. I'm the founder and the CEO of Kitso Lesedi Community Development in the city of Tshwane, Acadia. I think it's Region 3. And I want to start to say Kitso Lesedi started to respond to the COVID-19 as early as March. And because we are saving people in the place where they are, like in the parks, under the bridge, in the crossroad, everywhere. So we started to go out and do early intervention by teaching them about or empowering them about the regulations regarding the COVID-19 with social distancing, the mask, the washing of hands, and the emphasis was washing of hands a lot. And we even distributed small soap to say, put it in your pocket. Everywhere you can find a tap or a water somewhere, wash your hands. And then comes a shutdown, and we were also involved. We also started at Caledonian, and we went to all the temporary shelters, but then we ended up with the small ones within Bethesda Drop-In Center, 430 Madiba, Sidiba Hope, and lastly we were, okay, the Capital Park also, and we also we were requested to supply dinner to Reliable. So the first thing that I want to explain or talk about is the social worker, which it has been for me a concern of confidentiality of the information they're taking from the beneficiaries, especially during this COVID-19. It was a lot expected from the social workers. And I want to explain to say the social workers are the custodian. And me as the director or the CEO, I'm the steward. So we have to respect the information or the report that we get. Let us not be careless, especially during this time and thinking that this is crisis. Let us remember that these people are giving us this information, trusting us more. You know, so confidentiality at Kitso Lesedi is a primary principle that needs to be maintained throughout every level of intervention with the homeless community. And confidentiality help us to build and maintain trust. And it is also ensuring us an open and honest communication between the professionals, which is the social workers, the client, and the family members, and the stakeholders. So a homeless person is accessing Kitso Lesedi services and trusting them with the confidentiality. Then come to the one thing that we can call it as specialized services that we're giving in the temporary shelters. One of them is family reunification. And family reunification, Kitsoli said, defined family reunification as a process of reuniting homeless individuals with their family of origin or next of kin. And there are many considerations that needs to be taken into account when initiating a family reunification. And it was very difficult during the lockdown because most of the people, they are coming from outside the province. So you cannot just take a person who were not able to take them, those that were interested or showing interest of going back home, which I think at the beginning, most of them wanted to go back home because they were scared. But when they start to get familiar, you could see that it actually is no more like that. So our family reunification goes like this. It is important that safety of the individual, whether it's a child, youth, or adult, because we've got children in the street, people that are not even 18 years yet, is paramount. So the reasons that led to the individual to leave home needs to be very well addressed. The social worker rendering the reunification service should investigate reasons leading to the homeless and take action to prevent those causes from recurring. So the social worker needs to provide counseling to the beneficiary as well as the affected family prior to the reunification process and after the reunification. So we do a lot of phone calls now. We were doing a lot of phone calls because we're not able to travel freely to the places where the affected families is. And so we were confronted by some challenges right there. And then the social worker should give more attention to strengthening family while their loved one is in a care, you know, while we are with these people, because when we hear what caused this homelessness, we're talking to both sides, and we want to hear the story from both sides. And then the social worker should facilitate visitation while the beneficiary is in care. This will help the family to build trusting bond with the beneficiary. So it's that process that we're taking, and it is important that the social worker keep visiting the family post reunification. We've done that in Mamelodi, in Soshanguve, in the surrounding, actually, the townships and the surrounding villages that are not outside the province of Gauteng or outside the region, which is our city of Tshwane. We're able to do that. We're able to visit and work on it. And then successful reunification is characterized as a service where both the beneficiary and the family members are engaged in the family reunification processes, enabling them to be involved in decision-making and commit to working with the social worker. So Kitsoli said social workers will track the family for a period of 12 months. Most of the time, we don't take long with them, visiting the family on quarterly basis to get feedback and assist where they still experience difficulties. So way forward, and with our experience with family reunification, we want to involve the community in the process, as the community as a whole is also affected, especially in cases where we deal with a rehabilitated service user. According to the system theory, when looking at the beneficiary, we need to look at them as a system with connected islands. The system theory will help us understand the behavior changes that can occur within the beneficiary's life. One of our objectives is to empower them in order to mainstream them back into the society and simultaneously empower the affected family. We learned a lot out of this COVID-19. One of the things is the programs that we also rendered. It was drug and substance abuse, where we were monitoring the methadone that they were given, and also to make a follow-up if a person still needs to go to rehab and all that. And on the case of health management, we were also identifying those that have default And okay, I'm finishing. We managed to put them back into their chronic medication. And we were serving food in all those shelters that I mentioned. Some of the shelters were not giving any services except food, like Family, like Reliable, we're giving them supper only. We did not do any social services. Thank you very much.
Lovely. Thank you very much indeed, Marky. Sorry to rush you, but that's my job here. So next up is
It's fine.
Melinda.
It's fine.
Thank you. Melinda van Niekerk from PEN, another of the NGOs in the CBD. Are you there, Melinda? I'm not hearing Melinda. So I'm not sure what the problem is, Melinda. Perhaps yeah, I'm just concerned about us not being able to progress now. So perhaps we should go to the next speaker on the program, who is Wilna de Beer from Tshwane Leadership Foundation. Are you okay to go, Wilna? And then we'll try and come back to you just now, Melinda.
Okay, thanks, Mike.
Wilna.
Right, am I on? Okay. Yes. Can you hear me, Mike?
Yes, I'm hearing you loud and clear. Thanks. Please go ahead.
Good, good. Okay. I'm excited to share with you the plans we have to develop supportive housing for older persons in the inner city together with East City Housing. The building currently called Hofmeyer House in Lillian and Goy Street used to belong to YMCA, and in the early years of Pretoria Community Ministries, we offered to YMCA that we will manage the housing for them. In 2013, the ownership of the building was transferred to Yeast. This plan I would like to share with you is to transform Hofmeyer House into the inn, offering a safe and restful environment for tenants living in a residential community, which will combine social housing with supportive housing for older persons. The name, the inn that will be used in future, refers to the biblical text where it says that there was no room at the inn for Jesus. So the inn depicts a safe place and a place of rest, happiness, and peace. So we're proposing an emergency supportive housing intervention program. Hofmeyer House has 54 communal units. It is proposed that 15 units be available to older persons who receive a social grant or a disability grant from 50 years upwards. In phase 1, there will be sharing of rooms, meaning that we can accommodate 30 older persons. Supportive housing is a dignified method of affording older persons a permanent living space where they still have a great degree of independence. It is a combination of offering housing and offering social support services. So let's just look at the situation of older persons and access to social housing for a moment. The World Health Organization indicates that the world's older population will be at 2 billion people by 2050. There are currently 5.2 million older persons living in South Africa, and in Gauteng, 1.167 million older persons. So increasingly, if we look at street homeless populations in South Africa, it is not only the much younger, but also older persons who end up on the streets. Broken family ties leave elderly people living on the streets. In addition, the ability of older persons to secure employment, issues like chronic homelessness due to substance use or histories of mental illness leave older persons extremely vulnerable to homelessness. Older persons whose only income is a monthly SASSA grant of 1,800 Rand are unable to secure affordable rental housing. Government has taken a policy stand that families should take care of their own older family members. They have hugely reduced subsidies to old age homes. Most old age homes ask rentals of minimum 6,000 Rand per month. So the vulnerability of older persons we can see is increased. And now the immediate threat of COVID-19 virus is in front of us. Older people and people with comorbidities are known to be the most vulnerable groups in case of being infected. So they are more likely to develop life-threatening symptoms and they need special care. Since the lockdown, TLF has established a facility for 19 older persons with chronic illness called Tau Village. However, the need is much more acute and huge collaborative efforts will be needed. There's an immediate need to create between 500 and 600 new bed spaces for older persons to address the crisis of older people's homelessness. I want to share with you what a research team from the US who did research for the University of Pretoria on street homelessness said, and here is one of their recommendations for South Africa. They say, most broadly, we recommend transitioning away from defining homelessness as an issue of social dependence. Our research suggests that homelessness internationally develops from a lack of affordable, accessible housing. Therefore, housing should be considered a universal and constitutional right as per United Nations recommendations. This should lead to the development of an affordability threshold that assesses what South African elderly are willing and able to pay. Let me tell you quickly then what we are busy developing with Yeast and share it with you as a model that can easily be replicable. Hofmeyer House has 54 communal units. The project will be implemented in 3 stages. Stage 1, urgent and immediate, housing of 30 older citizens in 15 units, 2 older citizens per unit. Initial refurbishments will be done and ready for occupation by mid-June. TLF will offer social work and medical services, cleaning of the rooms and offering of 2 meals per day. The rent will be 700 Rand per person per month. Stage 2 is preparing plans for a permanent refurbishment and sourcing funding for the capital costs. And in stage 3, renovation of the entire building into a mixed income facility, combining social housing and supportive housing, and ideally creating self-contained bachelor flats or single-room communal units. In order for all of us on a national level to replicate models such as this, we would need considerable capital investment into the development of such facilities. I am therefore interested in developing a homeless investment fund, a fund which would be separate from NGOs, the churches, and the city. And the purpose will be to invite huge capital investments into this fund with the purpose of using the funds for development of housing for homeless populations. Such a fund could support efforts nationally to develop supportive housing models for homeless communities. So please contact me if you are inspired by this vision and would like to participate in developing it. Housing is a basic human right. Let us work together to provide decent, affordable housing with a special focus on the most vulnerable. Thank you.
Lovely. Thank you very much indeed, Vilna. Let's see if we can get Marinda on the line. See if we can hear her.
Yes, thank you. I hope you can hear me clearly now.
Yes, we can. Well, I can, loud and clear. Thank you very much.
Thank you. So I am Marinda van Niekerk and I am heading an organization called PEN. We have been working in the inner city of Tshwane since 1992. So one of the principles that I think we've been struggling with and really come to understand better in this difficult time, thinking under the heading of support infrastructure, is the concept of agility. Agility would mean to move quickly and easily, to have the ability to think and understand quickly, But I think PEN has come to clone the word start small, learn fast. So in this time of trying to mobilize support and infrastructure for all of our for all of our shelters, we really were challenged under this disaster reality to mobilize very quickly and as many people as possible. One of the biggest efforts over the years that we had to put our energy into is networking. We hear that word often, but I think networking is a principle we had to learn to say it's working like a bank. As long as you put money in your bank, the day you actually need it for an emergency, there is something to withdraw from. And I think our story is one of those in trying to mobilize mass support for all of our shelters. This was a telling story of the beauty of building into networks over the years. So success of those networks are based on trust and really relationally founded. So some of the infrastructure that was needed in this challenging time was specifically regarding physical resources. So what was being organized was at the Dutch Reformed Church at Ooskerk, a resource base was set up, as Wayne has referred to. So it was really an interesting process in the time that you couldn't move around. An app was utilized called Breeze, where people could nominate exactly what they would want to donate. And through national security guards, those donations has been picked up at your house and delivered at our depot for collections. Over this time, I can bore you with how many bags of clothing, how many tons of food, how many hugs and words of support was collected over this beautiful time. So we were inspired by the gifting, and the hearts of people are really open to when there's a real practical way for them to get involved, people react to that. One of the biggest infrastructure that was needed was regarding transport. So through the vehicles and the staff that was just pulled in from our other activities within PEN, it was possible to mobilize a transport infrastructure. We have many old tannies and women sitting somewhere and wanting to become involved, and many of them became involved in making masks. So we were in a position to provide buffs for our homeless community and masks for many of our people working in the shelters, and to be safe. This collective initiative of money, bags of clothes, tons of food was really inspirational for us to be part of, and we in such a way that we are committed to keep this service going forward post-COVID. One of the systems of proper communication was a big need for organizing. So WhatsApp groups was used for the site managers, and collecting data became a very important point to be able to communicate well with our site managers. Specific tools was developed during this time. Tools of standard operating procedures, templates was designed on how to run your shelter and how to order. Training manuals was designed as a collective effort through the Homeless Forum. And I think one of the most beautiful outcomes that we experienced under the heading of communication was the collection of stories through a team from Floatiston. I hope you saw some of the videos that was made out of our amazing through Floatiston that they put together for us. Part of this collecting stories and documenting the process. Systems was for data collection became a very critical point in this process. I think as Markie also referred to, it became very important to be able to know on a daily basis what physical needs our sites have, what social needs came up for all of our individual person by person beneficiaries. The medical needs had to be coordinated, so together with the family medicine and the app that they used, that was a wonderful add to our whole process. And that just the accessing information on a general level became a very important, through the WhatsApp teams, it became very important to be able to run this. I think one of the principles we learned was identifying trends really that can make informed decisions. You know, so I think one of the principles that we had to implement throughout this process was to capture information, reflect on it, learn from those trends and information, and adapt accordingly. So we hope that some of these principles and values can be carried through, and that we can be able to support the rest of this process going forward. And lessons learned is really valuable, and we will be able to take from those lessons learned and move this process forward. Thank you.
Thank you so much, Miranda. So I believe, sorry, I'm not quite sure how to pronounce these names, that Tshwane is not able to join us, but Libowani is here. Could you unmute yourself and start speaking, please? Libowani, are you there?
Hello?
Yes, hi.
Yes, are you hearing me?
Yes, loud and clear. Please go
Okay.
ahead.
Yes, thank you. This is Libuwani Nemutenga. I'm from the city of Tshwane, the health department specifically. And I have been part of the work that has been happening since the announcement by the president of the lockdown. And what I found out of the whole process was that when we started, it was really difficult because it was like we were learning as we were moving, and the demand was quite huge. And what came as a sort of an assistance was the fact that the city of Tshwane had already had a partnership with the University of Pretoria to implement what we call the community-oriented substance use program, which is a program to assist people who are using substances, mostly those who are using opioids. And that really came handy, because if it was not for that partnership, actually, I don't think that the city would have really been able to move swiftly and be able to address the needs. Because one of the things that we've experienced was that a lot of people who are street homeless people, many of them were using opioids or were using substances. And as we got to get them together and housing them in these temporary shelters, one thing that was clear was that the issue of withdrawals. And without the intervention that the city had in partnership with the University of Pretoria, that would have been a difficult moment. And we were able to intervene through that partnership, in that we were able to provide treatment for withdrawals. And the numbers were really massive, and were growing day by day. But with the partnership, that was easy. And just to speak to this issue of the partnership, which really came handy at the time, was that we already, like I've indicated, that the city of Tshwane has this partnership through a memorandum of understanding and a service level agreement with the University of Pretoria to provide this service, so that we can assist to support people who are using substances. And ours has always been a humanitarian approach that seeks to assist. And it came in handy at this point in time during this COVID-19 response. And as we were starting to provide this support to the homeless shelters, our focus was on the treatment for withdrawals, but also general health services support, which included the support for acute and chronic support, And also, as it went on, as we were providing this service, all the shelters realized that there are other things that we also needed to do, like, for example, the handling and disposal of medical waste, which as a city we had to come in and provide support to all the shelters that Tinyiko has already referred to, saying that there are around 23 shelters, and also Professor Yuho, whom we have been working together for some time now, since 2016, also has reflected on the numbers. I felt like after he has spoken, actually, there was not much left for me to address. But having been through this process from the beginning, one thing that I've learned is the importance of partnerships. And since the Mayor Tselapedi has already reflected on in regard to the support that they've provided, we also have that partnership with the not-for-profit organizations, which in this instance, those not-for-profit organizations were also brought in to provide the services into the homeless shelters across the city. And having started with the 2 NGOs that, or not-for-profit organizations that are within the city, which is Kopano Manyano and Kitsoli said, who came in handy because we had funded them to provide support to the homeless people who are using substances within the inner city precinct. And also with the extension of the services and the partnership that we had, having joined the partnership that already existed between the city of Tshwane through the community and social development services and the homelessness forum, our support went beyond the facilities that are managed by the city, but across all the facilities. And the one thing that has also came out handy is the issue about the availability of the registrars from the family medicine. With that capacity, actually, it has eased the burden that would have been on the shoulders of the city of Tshwane. With the limited capacity of medical officers, I don't think that we would have been able to provide the service that we've been able to provide through the support of family medicine department from the University of Pretoria. And as we continue to work, there are quite a number of challenges that we face. Tinyiko referred to one of them about the issue of security. But one important challenge is about commitment. And I think that we need to continue to educate one another, including the education of the residents in shelters, that as we work together, actually is for the benefit of all of us as a society, include the benefit for the users, because sometimes there are other perceptions that sometimes don't help the situation in terms of how we have to support the residents in the shelters. And as we move forward, one of the important elements that we need to work on is the development of standard operating procedures, so that we can know that as we continue providing the service, there is a standard way of providing the service. Although the situations will not be the same, but at least there should be a template of where we move from. And one of the standard operating procedure already I've seen is the one on the provision of the health services, which we are processing now within the city. And I think that, thank you very much.
Excellent, thank you very much indeed. So we have some time now to take some questions. So I'd invite you perhaps just to think about a lot of the information that you've just received. Perhaps there's something that you'd like clarified, something that you'd like to know a bit more about. So you can put your hand up using one of those indications that I indicated earlier on, or you could put the question in the chat, in the chat room, and we'll direct it to one of the speakers to respond. Yes, Tshwane, go ahead, please.
Yeah, thanks, Chair. I just there's one question that I always wanted to ask, more special on the health side, and I think this is one while we're going around doing some sort of audit and checking with social workers. Always wanted to find out the issue of administration of is it the methadone. I wanted to check from Dr. Yuko in terms of how far is this process? How far does the process actually take, the administration to a person? For how long does it take? At which stage do we get to say now it's you can't take it or you can take less and all those kind of things? I wanted to just get more clarity on that.
Right, thank you very much. Professor Hugo, would you be able to respond, please?
Yes, can you hear me?
Yes, we can.
I think it is a very important question, and thank you, Tshwane, for that question. In the harm reduction approach towards specifically opioid addiction, which is the most prevalent in Tshwane, the opioid substitution therapy is to assist the person to deal with both withdrawal and the craving. And craving continues for a long time. And the international evidence is that you do not start the opioid substitution with the view of reducing it very quickly. And the average successful management on opioid substitution can go up to 8 years. So it is not to say that we give this for a short time and then see if we can taper, because that is that's leading to not such good outcomes. If you give at an adequate dose, and like we say, low threshold without too many strings attached, it helps the person to stabilize his or her life and to develop a way of living. I can just mention
I'm losing you, Prof. I don't know if you, but I'm struggling to hear you now.
Is it back?
Yes, that's better now. Thank you.
Okay, very quickly. It's not a short-term treatment. It can take up to years. And in Switzerland, people are in old age home on methadone. So we see it more like you would see insulin for a diabetic. Some of them reduce and don't need it, but some use it for a long time. Does that clarify?
Thanks, Prof.
Right, thank you very much. I see a hand from Alexander Melk. If you'd like to state your question, please.
Hi, thank you. So yes, my name, as you mentioned, Alexander. Just quickly want to find out, I'm looking at the Pathways Out of Homelessness infographic, which I received a while ago, and it's really nice to hear everyone's contribution, and I want to thank you everyone for that. And I'm just looking specifically, there are 5 priority areas that were previously identified. So 1 was diverse housing options, 2, economic opportunities, 3, psychosocial and health care infrastructure, 4, advocacy, education and awareness, 5, institutional infrastructure. It sounds like we have 4 out of 5 covered, which is, I think, great progress. I was curious, is there any partner out there or identification of number 2, economic opportunities? I think all 5 need to be, we need to have some form of a strategy or partnership to really solve this. And I was curious about if there's any development on that one. Thank you.
Thanks very much for the question. I'm not sure if somebody is equipped to respond to that. Perhaps somebody from the city?
I
Perhaps.
can try, Mike. I'm not from the city, but I can try. I'm
Yeah,
not equipped to respond to that, but I think what Alexander says, I just want to echo and say that is, I think, the one area where collectively we've probably been weakest. And we have to figure out how, and I mean, the reality is that even in the current shelters, probably the majority of people are these days, based on the research that we do, but also just from common sense, are young, Black, unemployed men. So we can do all kinds of other stuff, but if there is not an economic response as well. So I just want to echo that and say maybe there aren't answers around that yet, but perhaps a collective like this one in this conversation must apply our minds much more deliberately to this very specific area of concern.
Thank you. And I think Tshwane has a response as well. Tshwane?
Hello?
Yes, go ahead, please.
Yes, it's not necessarily that I have a response to the question, but I think that I wanted to actually contribute to the discussion. But I can start with that one of economic opportunities as a question, but also not necessarily that I give the answer to it, but also just to enhance the discussion. With the partnership that we have with the University of Pretoria, one of the elements that we are also addressing touches on that, because we seek to empower the users as part of the aftercare program on how we support the users to reduce the harm. So part of our deliverables is those economic opportunities, employment opportunities, of which some of the people that we work with, who are, some of them are part of the beneficiaries themselves, have had has got the opportunities from the program as peers, and that becomes sort of also an economic opportunity in itself. But also there are those that through this support have been able to be in self-sustaining initiatives, being able to be more productive in their own space, wherever they get the employment. So that is how we have been able to contribute. But I think that if we work together in the same way that we did in response to COVID, bringing together all the stakeholders, we can be able to bring in more partnership that can respond to it without necessarily having it in the hands of one institution, but having a central facilitation. I think we can move forward. And my contribution beyond that was going to be that my experience in this program and having engaged in it so far, I think we need to do more to raise the level of commitment amongst the beneficiaries, mostly in the bigger shelters that we have seen, like the Little Tshwane shelter and its challenges, and also going into the Mabopane Indoor Sports Center, although it's much better than what we see in Little Tshwane. One of the questions that have been asked by the colleagues from Community and Social Development Department is around having the capacity at shelter level of somebody we can call a community health worker, who can provide an advice and support on a continuous basis to the beneficiaries, including most importantly on this part of monitoring, social distancing, adherence to some of the basic things that will prevent infections. And I think that I was still to engage with Professor Yuk on that, to see in this partnership that we have with the University of Pretoria, how do we come in there, and how do we involve maybe the province, how do we involve maybe the city in getting some of the initiatives that we already have on community health workers to be part of this program. And the other part, I think, out of what was raised around the 5 priorities, one of the things is like the facility themselves, the development of the facility, because where we are now currently is mostly temporary, and those facilities are having their own use. And at some point, we'll have to get back to utilize them for what they were built for. And I think that will take us back to the need to build or or avail the facilities for shelters, even if we can't necessarily maybe say it's a permanent shelter, but it will be the shelter that the people will be able to utilize. But the building will be there, even if the people do come and pass and do come and go. I think that for now, that is my contribution.
Well, thank you very much. We are starting to run short on our time. So I do see the other two hands, but I'm afraid I'm going to leave those for the moment so that we just continue with the program. And perhaps there'll be a place for you to raise those later or else afterwards. I think it's just part of this process. So then if you could just move on with the slides there, Wayne. I think next up we have a section where we're trying to get beyond the lockdown situation. And Wayne has a video clip for us, which I believe will help shift our thinking towards thinking in this direction.
Mike, can we maybe, sorry, there it's going.
Throughout the world, in countries rich and poor, tens of millions of people are struggling to survive on the street or in limbo and temporary shelters. Most people are familiar with the sight of homelessness and agonize over what's to be done. But homelessness is a solvable problem. I'm Roseanne Haggerty. I'm the president of Community Solutions. Homelessness is one of the most serious contributors to poor social outcomes. It undermines families' and individuals' health, their ability to maintain employment, children's ability to complete school. Long-term homelessness takes as much as 25 off people's lives. What we're learning is the solution to homelessness is to reframe it as a public health challenge, not simply a problem of housing supply. And that requires a very different approach. The Built for Zero initiative is a national movement that involves 75 large cities and counties in the United States, and it's shifting the way communities understand the problem. First, a community has to understand that this can't be solved by a collection of individual program efforts. What is needed is what we call more of a command center approach. Everyone around the same table agreeing to share a single goal, which is zero homelessness. The next big shift is using by name real-time information. Each person, each family is experiencing something very different in the form of a housing crisis. And without knowing that information, it's almost impossible to permanently solve their situation. And then lastly, building housing or providing other resources in response to what your community's data is telling you is the specific problem. Communities like Rockford, Illinois and Jacksonville, Florida were early adopters of our Built for Zero initiative. They were willing to do the work of bringing together a community team that would operate above individual organizations. They have gone out and identified by name everyone experiencing homelessness in the community, and they match resources to the specific needs of individuals. They problem solve as a team on a weekly, if not daily basis, and that's changed the game in these two communities and many others. We now have 12 communities in the United States that have ended chronic or veteran homelessness. And what's striking is that communities have different resources, different cultures, but this different way of working is making the difference. Imagine a world where homelessness is rare, brief when it happens, and really gets fixed for those people to whom it happens the first time.
Great, thanks, Wayne. I'm glad you got that to work. Genevieve, are you there?
Hi.
Ah, yes. Your screen's
Hi,
up.
Mike, I'm here. So as we reflect on this little clip, it's really special for those of us in the forum to actually hear about this, because this is kilometers away across the seas, but we find a lot of resonance in between what happened with the American examples and case studies and what actually happened in the group that was formed in response to the COVID crisis dealing with homelessness. So Haggerty looks at the fact that most of the people in our nations around the world are familiar with the sight of homelessness. And she also talks about the millions that struggle to survive on the streets globally. But despite the situation and the chronic crisis which has just been exacerbated during the time of COVID, she wants to offer us some measure of hope. And she says that homelessness is a solvable problem. Now, in our experience, in what happened in this city, is that we, as the weeks began to unravel, we discovered too that homelessness is indeed a solvable problem. And we can certainly imagine a world where homelessness is rare or brief when it happens and gets fixed quickly when it happens. So we totally agree with that, because that has been our experience since starting this process. Now, Wayne, are you going to put up a presentation for me?
The presentation is up, Jen.
Thanks, Wayne. Thank you so much. So basically, as she goes on, she talks about, I just want to move to the next slide. She talks about this being a collaboration with 75 large cities and counties all across the US. And she said that the problem of homelessness can be solved, but it's going to require a new type of effort, a new type of thinking, and a new type of activity and working together. So she said what they adopted was a command center approach. And what was critical for the commencement of this command center's efforts is that all role players were to agree to the principle of zero homelessness, but not only agree to the principle, but be able to commit to the practice of dealing with the problems of homelessness and understanding that this problem can be solved. So that was the one thing that we found in synergy with our work in the city of Pretoria. We too established a central command center. We used that approach, and it happened just quite naturally. Our role players around the table agreed as well to zero homelessness, and also agreed that the problems of homelessness can be resolved. And we were able to assemble around this table with the shared understanding that we have a common purpose. While all our organizations have its own organizational and individual purposes, when we came around that table at the Central Command Center, or the Central Command space that we met, we were actually coming together for shared purpose, a purpose that we all agreed and had shared interest in and shared commitment towards. And then we committed to collaborative learning and impact. We did not want isolated impact. We wanted collaborative impact. So whether it be resourcing the sites, whether it be the screening of the sites, whether it be the psychosocial support to sites, or the safety and security of the sites, or a legal opinion about sites, or faith community support to the sites, whatever it was done collaboratively, so we were able to benefit from each other's rich resources in experience, insight, and expertise. And what we saw through this collaborative approach was collaborative impact, not minor slivers of impact, but quite significant impact on scale and scope. And then we also were able to tailor contextualized programs. So through this collaborative approach, through this combined learning and mutual and reciprocal learning and sharing of resources and so on, we were able to decide on contextualized program efforts, which is similar to what the US communities did. In our case, we were very, very intentional to work in a multi, inter, and transdisciplinary manner. And not only did we work across disciplines and expertise, but we also worked outside of the city, linked with other cities across the country and across the world. We can move to the next slide. So what we saw in both the US case and in our case, we worked with by name real-time information. Those that were part of the task team, those in the Department of Social Work, those in the community health work, all contributed to availing data to the Central Command Center. So we had by name and real time. We were able to look at each case from both the health and the social perspective. And this data was able to inform the decisions we made in the Central Command Group. We were able to work collaboratively and through a consultative problem-solving method. And this was very, very important for us. Some decisions could not be made with haste until they were adequately consulted because of the sensitivities involved in this project. And so even though in certain instances it was challenging and there were tensions that arose, but it was a consultative process. And not the kind of rising tyranny that we are seeing around us, but a highly consultative process. The building of houses and the new plans for the city in terms of how it will deal with the challenges of homelessness and its commitment to zero homelessness, the availability and provisioning of cost-effective and affordable housing, all of that now can be based on this excellent data that has been gathered during this time. And we're really so grateful to the various entities that have painstakingly worked across all sites to gather this high quality and current data. I mean, I was once at a review where the Medical Research Council was talking about how difficult it is with many medical studies because of the currency of the data. But here we have really such a wonderful opportunity to make sure that our future plans are based on high quality data. And just like in the American case as in ours, we were able to match resources to the needs at the sites using this collaborative shared purpose approach, which is far better than a competitive approach. So one of the new things that we've learned is that we need a shared commitment. And once we get around the table, we carefully plan and prepare. Preparation, nothing can happen with realistically thinking critically about what we are about to achieve and the steps involved. So many of my colleagues before me kept going on about the procedures and the protocols that were put in place for this to happen. And then aside from the careful planning and preparation, and this had to happen carefully, but with some measure of swiftness because of the disaster that was unfolding before our eyes. And so we made sure that we also included all the voices that we could possibly get around the table. So we wanted the voices to be representative across a wide variety, so that we can have a diversity of people's voices, ideas, and we can build this groundwork for combating and dealing with the challenges of homelessness, having multiple voices from multiple spaces, bringing in a rich fabric to the discussions on zero homelessness. We keep going on about this issue about collaboration, shared purpose. And these can be buzzwords. They can be used just to rubber stamp something that just has a veneer of collaboration. The fact is, true collaboration hurts, it pains, but it is far more valuable at the end of the day. The rate on return is far better when we have collaboration, no doubt about it. And so as we work together, we pull the threads of civil society, business, community groups, faith groups, the city, higher education, different arms of government, all working together to advance a common good. And we have seen very effective results in this period of time, and almost miraculous results in this period of time. So anytime you hear the words collaborative, shared purpose, and so on, think about the hard work that goes behind sharing a purpose, defying your own commitment to your individual purposes, but sharing the purpose as well as the collaboration. Very critical new ways of working. We knew about them all the time, but we didn't commit to those ways. Then as a team, we were working with design thinking. Everything we designed, the procedures, the processes, the stages, the criteria, all of those aspects were designed with the user in mind. And we're tested and we're fine-tuned and adapted for the best possible efficient use. So this process is an ongoing process, and it's linked to the process of innovation, which can be incremental, not always once off, always designing, improving procedure, products, processes, and so on. The other types of thinking that we focused on are creative thinking. Certain things were almost impossible. They're very, very difficult. We had to develop creative thoughts and ideas and ways to get things done. When we can just move along. Critical thinking here. A lot of times you would hear something, you would have to investigate the strengths and weaknesses of an argument. You would have to determine the right course of action. We also wanted to be very careful to think in an innovative way. We don't want to constantly do things the same way for the last 20, 40, however many years and expect different results. So we really had to apply our minds to the way the forum was being run, its collaboration and communication strategies, what is the role of cities, what is the role of higher education, how did civil society respond in this time, and then we had to go on to strategic thinking, thinking about long-term planning, not just responding to this initial crisis, but to be able to take the full journey towards seeing zero homelessness in our communities. But we also involved ethics thinking. Every time we had to make a decision, we had to ask ourselves, is this the right and the best decision to make given the options before us? Because we were dealing with multiple stakeholders, multiple levels and dynamics of power, and so it always brings in ethical problems. And then finally, we were also thinking from a futures thinking perspective. We were looking at the trends, the signals, the forecasts. We were keeping every artifact of this time together and documenting it in a data management system and a project management areas documentation. And we were keeping watch over the drivers. In our thinking, we made sure that we always thought about what was possible, what was plausible, what was probable, and what was preferable in our strategies and the implementation of our plans. So these were the new types of thinkings, but above all, defeating the silo was among the greatest triumph of us working together. Thank you, Chair.
Thank you so much, Genevieve. I'm sorry to have to rush you. You have a lot to share. Thanks very much for speaking it up at the end. Stefan, over to you.
Yeah, thank you, Mike. I think I'm going to be 1 minute because I'd like it will be nice to hear another voice or two. So I was just going to speak about the fact that a post-lockdown plan is being developed. There is one in draft form, closely done with Teachers Department, as well as in consultation with health, group properties, and other departments. Wayne, I just want to take 1 minute, so if you can post that thing very quickly. Otherwise, we're going to take my 1 minute now. Yeah, if you can move, can you move to the next slide and the next slide? Next one as well, yeah. So the post-lockdown plan's emphasis are those 5 things: shelter, food security, healthcare security, comfort, and capacity development. The next slide is what Alexander referred to, Wayne. Those are the 5 programs that are considered. It's about shelter and housing. It's about economic access. It's about psychosocial and health infrastructure, ongoing advocacy, education, and awareness programs. And lastly, ensuring the appropriate infrastructure. So if you can just go to each slide very quickly, I'll take 5 seconds on each. Now, where are you now? That one. So on housing, so with group properties and others, the issue is that we don't want to see people go back to the streets who are now in shelters necessarily. And so group properties in the city are working with the other departments, with the Tshwane Homelessness Forum, to figure out how we can ensure facilities in every region of the city. And the dream there is of the 1,850 bed spaces, which includes some existing facilities to be upgraded, but also new facilities. The next slide is the one that was already surfaced. I won't say much more about that. And I think Livo's challenge or suggestions around having a similar approach than COVID-19 for the economic thing is a very good proposal. The third one is to make sure that in all those shelters, the psychosocial and health infrastructures that have now been developed, family reconciliation, all the rest will be rolled out. The fourth one is ongoing awareness raising and education in communities, so that shelters will also be hosted in communities and be decentralized to the different regions where homeless people are. And the last slide is to make all of this happen, the securing of the right kind of institutional vehicle, capacity building of those working in the different places, ongoing research and documentation, fringes of this. There are buildings that haven't been part of the official shelter, such as Melchizedek. And I see Dr. Bakis in the B. Intentional about findings. If they were not there, they would be homeless. I will leave it at that. Thank you, Mike. But so I'm basically saying there is a post-lockdown plan being developed, and more input still would be very welcome.
Great, thank you so much, Stefan, and for condensing your input there so smartly. So I'm afraid we are running quite seriously short of the time that we had planned. So yeah, we were going to do breakout rooms now, but I think in view of the very limited time left, it's not actually going to work to try and get into the groups and get to know one another in the groups and then have that conversation. So perhaps we should just do this in the larger group. These are the questions that we had posed to as some reflection, really. In terms of everything that has happened that you've heard about, what is it that excites you? What is it that has been exciting? How can we secure it and build on it going forward? And what do we have to do differently going forward based on what has happened? So we've spoken, with the speakers have spoken around these themes quite a bit, but perhaps there are some more specific things that we could just surface. So I'd encourage you to voice those again, but just for the sake of keeping a record of this, if we could please type that in the group chat as well. So Jenny, I see your hand, and I know you had it up earlier as well. So would you like to go straight ahead, please?
Thank you. So I'm from Penn, and it's interesting. At the beginning of last year, we launched a program called Vocational Wellbeing at Penn, acknowledging that if we do all of this wellbeing work, but we don't get people employed or employable, a lot of it is wasted effectively. And we did this work with youth and with vulnerable adults who were homeless. And we had very, very little success with the homeless. And the big barrier was, as long as I don't know where I'm going to sleep and where I'm going to get my next meal from, it can't enter my consciousness of what skills I might want to do or how I can become employable. And so we started looking at this idea of transitional housing for 3 months at a time so that people could have their basic needs met and start to think about the future. And then COVID-19 happened, and Bob's your uncle. Here's your 3 months. Isn't that amazing? And so we have piloted some of those ideas, vocational well-being ideas, in some of the shelters. I know at Oosterlig and at Bethesda. My colleagues at Kelly might be able to chip in, but around really, and it also speaks into what you were saying earlier, that there's many paths into homelessness and there need to be many paths out. And I think the learnings that have come out from doing this work during this time have been exactly that. Going in, speaking to people, understand the literacy level, understand if skills exist. Just because you're homeless doesn't mean you don't have a PhD, understand if there's an exit, where you're planning to go, what are viable income options in those areas. The economy is tanking, so employment isn't necessarily the way to go. Micro enterprise might be the way to go. So just combining that idea of being very practical and tailored to that person. So what excites me, if we've got food and shelter sorted for a few months, I really think people will be able to break out of this as long as we focus on vocational well-being as well. Thank you.
Thank you very much for that, Jenny. I'm just looking at the chat room. So there's some input there from Martin. This is the opportunity to get a nearly complete list and overview of everyone who's homeless, and this should be the basis for planning. Local action teams will be the way to combine input from the city, NGOs, and the local community. From Garth, what has been exciting is the availing of space and the sharing of surplus resources that will hopefully result in our guests regaining their lives and families and never ending up on the streets. I see 2 other hands there. Let me just see those. Martin, yes, please go ahead.
All right, thanks. I made that comment because I think if there is a time to break down silos and to reach out to each other, it's now. there are many good willing NGOs, churches, congregations, and other community organizations who are willing to help. But if I go to my own experience, you know, you struggle and you struggle, and you know, there is very little, say, action, combined action. We say the city with other NGOs that you join hands, sit around the table, plan together, and draft a plan for your suburb or your area. And I think, you know, if we can take that further from here, that would be a great step in the right direction. Because many people are willing, but there should be a platform, there should be a structure in place, there should be a sort of a local command center. And that should not only be an NGO, a group of good willing people, but it should be a much broader group, you know, with the authorities, the city involved, etc. Thanks.
Good, thank you very much. Tebogo and Lubani, I see your hands, so perhaps you could go in quick succession. Just want to keep the pace moving now. And I think those will be the only two that we have time for now, unless there's anybody else who's got something really pressing. So yeah, Tebogo, please go ahead.
Yeah, quickly. The thing that really excited me in Centurion was really breaking the stigma or breaking the prejudice that was when people saw homelessness, they saw people who were not visible in their lives. And to answer the second question, how can we secure it and build on it going forward? It's like what the last speaker has said. It's just, you know, being on a bigger platform which speaks in one voice and extending to other regions. And truly, zero homelessness is possible.
Lovely, thank you very much. Lubani, would you go ahead, please?
Thank you. Hello?
Yes, go ahead, please.
Yes. What I will say has excited me is the power of partnership. Like I've indicated that the relationship that we have with the not-for-profit organizations, some of them which were funded and some of them who are operating with their own other resources. I think that's one important element that I think has excited me. And I think one of the things that I think should be what we should do differently is when we were housing the homeless, it was like sort of putting together people by enforcement of some sort, and that makes people not to have a buy-in and think that they are doing it in favor of somebody. So I think that it must be made to be a matter of choice, and it must be attractive to be in that space, not that you need to be forced to be there. You must see the benefit. And the other thing is then that will have to build the commitment. And right now, I think we are here on this colloquium, but we have last met as a team in a long time. And I think that is something that has gone wrong, which I think we need to correct going forward as a team that is working on this so that we can get back to the space where we do have our weekly or bi-weekly reviews so that we can build our capacity. And this was based on the fact that we had a task team, and now it looks like it has disappeared unless if I'm just not aware of what is happening. Thank you.
I hope the people who've been driving the command center take note of that. So at this point, I think I'm going to close questions. Be aware that this tonight is obviously one important step in the process. It doesn't shut the conversation down. So if you've got other issues, please communicate with Wayne and Stefan. At this point, I'd like to ask Rihanna and Yanni just to make some closing remarks. Obviously, as briefly as you can, please, without...
Mike?
Yes.
Sorry, just before, can I just say something just before, Rihanna? I just want to ask, sorry, you might have said that, but I would just want to ask that people, these comments are so great. If people have more like that, and I see Wayne say other questions or comments or suggestions, please send it through so that we can make it part of what we collect this afternoon, and also that the recording will be made available to everybody if you missed something or came on late or something like that. Sorry, thanks, Mike.
Good, thanks, Stefan. Okay, back to Rihanna.
Good afternoon, and thank you for the opportunity. It was very insightful to listen to, as Stefan pointed out, to the entire conversation. I'm going to be very quick and just make two connections here. One of them is that Roseanne Haggerty touched on something very important, that homelessness is solvable. And I think if we connect that to what we have experienced throughout the COVID-19 crisis and how the city has responded, there is a demonstration out of this crisis that the city, if needed, can do things. And I think that is something that we should not forget and hold the city to it. That in times of crisis, it can come and provide us with solutions and provide us with the necessary infrastructural needs that one would need to address street homelessness or homelessness in general. This then brings us to the other remark that needs to be made, is that one of the things that COVID-19 has introduced is that there is a way of doing things. There is what people are calling a new normal. I would like to think that it is not going to be a question of the new normal, that that which has started can continue and would become normal. And in this way, we would then be doing what was done to combat plagues and illnesses in our past, in history, for example, where what started out as something to help humanity became normal. I think this is one time where we should see this as a portal that allows us to go through and make that which is an emergency requirement today the normal of tomorrow. And I will end there. Thank you.
Thank you so much, Rihanna. Yanni?
Thank you. Firstly, I want to say that I want us to act on behalf of the whole of society, and like Rihanna said, push society to another normal in responding to homelessness, and that it be a whole society response. The second thing is that now is the time to much more clearly engage homeless people in the discourse, in the solutions, and in the future plans. And the last thing I want to say is that this is a very clear demonstration of complexity. And the one useful thing of working in complexity is the saying that says the interaction between the entities are more important than the entities itself. So for us as entities of organizations, individuals, structures, let's consider the way we interact with each other and create a new future in that way. Thank you.
Thank you so much. Colleagues, I wonder if you would indulge us just for a moment longer. So we are just about done. I'm sure that you would agree with me that just hearing the scale and the range and the comprehensiveness, as well as the attention to detail that we've heard this afternoon, has been quite breathtaking. But I wanted to do something else, and I wondered if, just for a moment, just for the last seconds really, we could all turn on our mics and turn on our videos. I want to just do something perhaps a little unusual for an online video, online webinar. And I would like to ask everybody who is not a frontline worker to stay where you are, but everybody who is not a frontline worker to stand and to applaud the people who are the frontline workers. I'm not sure what the ratios are, but whatever that is, can we do that just for a few moments? So everybody who's not a frontline worker, could you stand now with your mic on and just applaud all the frontline workers?
Specimens. Hallo, Sushi, Chris, Tommy, Vodka, Willie Smith en ander.
So thank you to everybody who has worked hard, who's done amazing things. And we look forward to hearing more about this and more of establishing this, more about rooting it, and more in pursuit of this amazing goal of actually making the end of homelessness possible. Thanks again for your time. I see just most people have stayed the full 2 hours, so thank you so much for that, and hope you all have a good evening further. Good night.
Thank you for organizing it.
Thank you very much. Night.
Thank
Good
you.
night. Good night.
Thank you.
Thank you.
Bye-bye.
Thank you. Bye.
Okay, bye.
Good night. Bye.
Bye-bye.
Thank you.
Goodbye. Goodbye. Bye. Bye.
Bye.
Bye. Goodbye. Thank you.
Yeah, bye-bye.